Using ultrasound, we can do a bedside diagnosis of pneumonia. And not only that, but a whole array of lung pathology. The bedside lung ultrasound in emergency protocol, better known as the Blue Protocol, has more than 90% of accuracy. Briefly, this is the technique. We're going to use two different probes, high and low frequency. These are the areas we're going to check. Areas 1 and 2 are in the front of the patient, while 3 and 4 are lateral and towards the back. This is an ultrasound performed 4 days after drainage of a left empyema. We are starting with the normal right lung. We set the probe over 2 ribs. We will be looking at the space between the ribs, called the bat sign. This is the window to look into the thoracic cavity. We see the pleura and the 8 lines that are artifacts of a normal lung. Watching in real time, we can see the lung sliding under the pleura. These bright artifacts show the sliding of normal breathing. When we freeze the image, we can see the 8 lines. Now we continue with the left side. We will find the diaphragm and the spleen. We are looking for pleural effusion that we didn't locate at this point. We ascend towards the lung. We locate a consolidation of the lower lobe of the left lung. There is also an area of mixed echoes between the ribs and the thickened pleura. The labeled image will better show the complexity of these findings. Let's take another look. We see the consolidation of the lung, the ribs, and the underlying area of localized mixed echoes where the drainage was performed. Looking at the top of the image, we can see the superior lobe. It's showing to have B lines, which demonstrate lung edema. Let's see other cases. Here we have pleural effusion and pneumonia. This is consolidation of the lung. The anechoic area is the pleural effusion. In this other case, we see a massive pleural effusion. This is the spleen, and the lung is completely collapsed, showing only this small echogenic area. This other case is a consolidation with bronchograms, which are these small, bright dots inside the lung. You can also see a small pleural effusion. These bronchograms are static and represent air trapped within the bronchia of the consolidated lung. In other cases, these bronchograms can be dynamic, showing air moving inside the consolidated lung while the patient is breathing. For the diagnosis of pneumothorax, we're going to use a high-frequency probe and the M mode. Real-time ultrasound shows the lung sliding, which in M mode has a pattern of a beach with sand and sea. On the contrary, with pneumothorax, there is no sliding. Thus, the pattern is only the sea without the sand. It is called a barcode sign. In occasions, we can detect the point where the lung finishes and the pneumothorax starts. This precise location is called the lung point. We're here including CT and lung ultrasounds from 2 cases from Wuhan. You can see that the consolidations are located right under the pleura. And in the ultrasound, they are shown as clusters of B lines. Here we're showing cases from Italy. Inside the squares, you can see the irregularities of the pleura. Within the arrowheads, you can see small consolidations, and all arrows point to clusters of B lines. In conclusion, many of the radiologists and most of the intensivists and emergency doctors recommend ultrasound for the diagnosis of pneumonia at the bedside of the patient, including the cases with coronaviruses.